Wake that ass up.
Early in the morning.
The Breakfast Club.
Morning, everybody. It's DJ Envy, Angela Yee, Charlamagne the Guy. We are the Breakfast Club. We got a special guest in the building.
Yes, indeed.
Dr. Torian Easterling. How's it going, Doc?
Oh, it's going great.
Does COVID still exist, man? Nobody's talking about it anymore. We're talking about the war. We're talking about everything else.
Roe v. Wade, everything's going on.
Playoffs.
Right.
Too
right,
much.
Right.
Too much.
Yeah.
The Book of Revelations.
That's it. Yeah.
So
but COVID
what's going on with COVID? How are we looking as far as COVID is concerned?
still exists. Pandemic is still here, and that's why I'm here. And I appreciate y'all for having me. But I think the top line is we wanted to let your listeners know that the pandemic is not over. We got to remain vigilant, but we're optimistic. We see cases, we see the hospitalizations going up, and we want to continue to do all the things that are keeping folks safe. So testing, masking, vaccinations. Now we have antiviral pills or treatment that is available as well. So it's just making sure that folks know what they can do to be safe, keep their families safe, and that's what we're trying to get the message out.
How strong is it now? What are those variants like? I mean, because we hear about the hospitalizations and we hear about cases going up, but is the variants as strong as they once were?
Yeah, we're not hearing about people dying as much.
That's right, yeah. So we're not hearing about deaths as much, but we're almost at 1 million deaths, right, in this country. And so if we get there...
Throughout the whole pandemic?
Of the whole pandemic,
okay.
Right. But I think the two things that we got to remember, we have more people who are vaccinated now, right? And so I think the other concern is, can this variant evade the immunity that people have either from a vaccine or if they were previously infected? And we know that this variant can do that. We've seen it with the Delta wave. We've seen it also with Omicron. And that's what's happening right now. The other concern is that we also have to remember that we still have our elders. We still have individuals with underlying chronic conditions. And so it's not just about death. It's about how do we ensure that individuals are not having what we know as long COVID, right? Or post-COVID symptoms, right? Weeks after people are infected, they're still experiencing symptoms. So we got to do a lot of things to continue to protect people.
So is it weaker or stronger? Is it?
Definitely, it's stronger. Yeah.
Really?
Yeah. Definitely.
So this variant that's out here now is stronger than the ones that...
In the sense it has a different characteristic than the ancestral strain, no question.
And it's more easily transmissible? More
transmissible, right. And also can evade immunity, right? And so that's the concern, because when you can evade immunity, so it doesn't matter sometimes when you have a vaccine or if you've been previously infected.
So how come we're not seeing more deaths then? Is it because more people are vaccinated?
More people are vaccinated. More people have been previously infected. So we are seing some changes in some of the data. Absolutely.
Now, what's the rules now if you get exposed to somebody who tests positive for COVID? Because somebody hit me just now and was like, hey, the person we were with a couple of days ago just tested positive for COVID. Does that mean, am I supposed to quarantine? Like, what do I do?
You shouldn't be here, sounds like it.
Well, I just found out, guys.
No, we all got tested to come here. Y'all
and
just
I'm
tested me.
vaccinated and boosted.
No, you got tested to come in. This lady over here didn't.
I did just get tested, but again, this just happened. So now what's the rules now in place?
Yeah, so you should still make sure that you isolate if you do test positive. You should make sure that you are isolated for 5 days before you return back to your place of work. But also you need to follow whatever your workplace practices are. So there may be additional steps that an individual will have to do. But I mean, here in New York State, the governor has already put out guidance that isolation period will be for 5 days.
And let me ask you this, all right? We've been getting tested a lot. And I've been around a lot of people who tested positive, but I still haven't tested positive. Are there some people that just have a natural immunity? Because I've seen other people saying, I still haven't gotten it. And not saying that you shouldn't still take precautions, but is that a thing?
No, it's not a thing. This is a novel virus. We've never seen it before. So there's no immunity antibodies that people have had before that are protecting them.
They're just lucky.
Yeah.
And I done had it 3 times, and I was around him, and I still tested negative.
No, my parents have had it in, 2 years, and they got it, about a week ago. So, you know what I mean? So you just never know. But I was going to ask you with, what is your thoughts on the airports, the planes, and the fact that they're taking this mask? Because you're saying it's even more serious now. But people are not taking it more serious. They're actually letting things go. You don't have to wear a mask when you go to the airport. You don't have to wear a mask when you're on an airplane. Restaurants, I don't even think they care anymore. You can go to the NBA games now. You can go to concerts now. So what are your thoughts on that?
Yeah, and Charlamagne asks, is this virus stronger than it was before? And that's why I was saying, yes, it is. Our data doesn't really point to, as many deaths as we have seen earlier. So I think we have learned a lot. And I think that's what we're seeing right now, that We're making decisions based on the information that we have now. We have more tools, right? Beyond masking, we have vaccinations. We are providing treatments for individuals who are infected. And so I think the decisions that are being made right now are really based on the information that we have, so we can be, just a little bit more diligent. And I think we're trying to give power back to people to say, what do you do based on your risk? You could be a healthy individual, or if you have underlying chronic conditions, you need to take your own precautions based on the risk that you have.
So tell me about this COVID-19 antiviral. Pronounce it for me. What Paxlovid?
Paxlovid. That's
I hit
right.
it?
You hit it.
Hey.
You hit it. Yeah. So we have an oral antiviral treatment that came out from Pfizer. You take the pills, 3 pills for 5 days. This is available for anyone who is 12 and older, who weighs 88 pounds or more. Essentially, what we're trying to do is if someone gets infected, you want to get treatment as early as possible, right? And that's why testing is important. So once you test, then you go ahead and get treated. Really, the individuals that we're most concerned about, and we really want to get access to the treatment, again, if you're elders, 65 and older, or if you have underlying chronic conditions. Because what we've seen is that someone who gets treated, we can prevent hospitalizations, right? So we want to prevent deaths, but we also want to prevent folks from ending up in the hospital.
Now, what about the Johnson & Johnson vaccine? We've seen that they've been saying not to take that anymore. What's happening with that?
Yeah, I mean, you hit the nail on the head. Don't take it at this point. So we want individuals who have taken 2 doses of a Johnson & Johnson vaccine, we want them now to take Pfizer and Moderna.
Goodness gracious.
Yeah. Mm-hmm. Yeah.
What? What happened now?
Yeah, so if you've taken the Johnson & Johnson vaccine, whether
gracious.
1 dose or 2 dose, because remember there was a booster for individuals who've taken Johnson & Johnson. We want you to take the Pfizer or Moderna vaccine instead, and so the booster is available.
Why can't you just say Johnson & Johnson didn't work?
No, it did work. Remember, because when we looked at
exactly.
That didn't work.
But it did. The data was clear that it was able to prevent hospitalizations and deaths, right? And so that's why we're saying it worked. What we're saying is the risk profile, is it worth the risk versus the benefit?
There was blood clotting issues?
Exactly.
But why we got to take it again if it worked?
No, you're saying for the booster.
No, you were protected. Right, it's a booster. So you were protected, right, in 2021, right, during the previous surges. Now we want to make sure that you're protected during this surge. And so all we're saying is that the booster is now available for individuals, for Pfizer and Moderna, for individuals who've taken Johnson & Johnson.
Because there were side effects of the COVID-19.
Because of the blood clotting disorders.
Is it off the market now? Because it's not even available anymore?
No, it's still available, but the preferences and recommendations.
Why don't they just take it off the market then?
Well, that's not for me to do.
You know what's messed up though? All and not just Kyrie, but all these YouTube conspiracy theorists who said that there was side effects to the vaccine, and people was like, "No, there's no side effects to any of the vaccines." That was a lie.
Yeah, but now you understand.
Well,
Kyrie, Kyrie said he didn't want to do it, and now you understand the reason why. Now they're saying, don't take that one because the blood clots. And let's say Kyrie would have got a blood clot. So you understand why his concerns were.
No, and we validate the concerns that there are symptoms that people are going to experience. We validate the concerns that there needs to be data to show like what are the side effects that can happen long term. And so the structure worked. As soon as we heard about the blood clots, there was information that we were sharing, and I think that's what we want to just like focus on. Is like, how do we get the information out so people can make a decision? But the vaccines, are unequivocally safe and effective.
It's like Southwest.
That's kind of
speaking, but you just might necessarily not want to fly that airline.
And you're kind of speaking out both sides of your mind. You can't say the vaccines are safe and effective, but then say one is causing blood clots. You can say some of them have been proven to be more safe and effective.
Yeah, no, I can say vaccines have been safe and effective, but we need to make sure that individuals who may be at risk of blood clots should not be taking this vaccine.
The Johnson & Johnson one.
Johnson & Johnson, that's right.
What were the numbers on that, like percentage-wise, how many people?
Well, I think the numbers overall were still small. These were rare blood clotting disorders, and so that's the other thing. So, we're talking about Kyrie. Kyrie doesn't really fit the profile for experiencing blood clotting disorders from Johnson & Johnson. It was particularly women during their reproductive ages between the ages of 18 and 44, right? And so these are rare clotting disorders, are rare events that can happen. But essentially, I think, again, sort of assessing sort of the risk versus the benefit of taking those vaccines is why the recommendation is now that individuals take Pfizer or Moderna instead.
How come, they keep talking about, like, boosters? Like, why they just don't say, hey, these are annual COVID shots, you have to take, like, flu shots?
Yeah, because, essentially what happens is the immunity that you got from the primary series, the first series that you received from Pfizer, Moderna, or Johnson & Johnson, that doesn't go away. So you don't go back to 0% of the immunity that we acquired from that first set. And so essentially the booster is really just particularly think of like it's a gas tank, right? Like you are recharging your station. You are making sure that immunity level doesn't go down to too low, so you're at risk of getting infected.
Are these vaccinations now effective against all of these variants? I know that was an issue at one point, that some of them work better, then they were developing one in particular for Omicron. So where are we at now with something that's effective against variants?
Yeah, that's a really good question. What we know right now based on the profile of the vaccines is that they remain effective against the Omicron variant, which is the dominant variant right now, particularly in New York City and across this country. Not as effective as it was against Delta, or the ancestral strain. And so we do hear that the manufacturers are looking at making a different version of the vaccine that's going to cover all the different variants that are coming out right now. But remember, we could hear about a new variant, right, in the next couple of months. And so I think what we know that the vaccines are continuing to work right now, and that's the good thing.
What's up with the flu?
The flu, still a concern. We're seeing flu cases go up even during this time. And so we are messaging that people should get co-administration, not only of their COVID vaccines, but their flu vaccines as well.
I was going to ask about allergies now. I see a lot of people who didn't necessarily have allergies starting to get allergies. Why is that?
Side effect of the Pfizer vaccine?
No. I think what we're seeing is, people are coming back out, they're rejoining, and I think that there could be, just sort of a change in the season that's causing an increase in why we're seeing allergic reactions to pollen and dust. But I think that that's something that we just have to continue to look at, and people just need to know what they need to do to take care of their allergies.
What are some long-term COVID effects that you've been seeing?
Yeah, so this is a question that we've been getting a lot of because people are now experiencing symptoms weeks and months after being infected. So we've just been trying to get the word out. If you are experiencing symptoms from COVID after your infection, weeks or months, you need to talk with your doctor. So someone can talk about shortness of breath. They still have a cough weeks or months after being infected. They may be having chest discomfort. Dizziness, or having a loss of taste or smell. Those are symptoms that happen early on during the COVID infection, and if they continue, they need to follow up with their doctor.
What about vision blurriness? Someone was telling me once they got COVID, they feel like their vision hasn't been the same.
Yeah. That's possible. Essentially, there's a mixed bag. It could be blurriness, it could be dizziness, it could be loss of taste or smell. Essentially, it's after the COVID infection. If these symptoms are still occurring or newly occurring, you want to follow it with your doctor. Here in New York City, we have 2 healthcare facilities that focus primarily on long COVID symptoms because we know that this could be a long-term issue.
Question, does the vaccine, I know the vaccine produces antibodies, but is there ever a point where the vaccine just flushes out of your system?
Yes. So in 24, 48 hours, the vaccines itself actually get rid of the materials that were entered.
So how do you, I guess what I'm asking is what causes the long-term side effects? Like how do you know when you're in the clear for having long-term side effects? Well,
that's the thing. We are still learning a lot about long COVID. There's a lot that we just don't know at this time. But particularly if someone's been infected, not necessarily from the vaccines, but if they've been infected because of the antigens from the virus. That's what we know is causing long-term symptoms from COVID.
And bless you for simply saying you don't know.
Yeah.
What I mean? I feel like over the last couple of years, we would have saved ourselves a lot of, confusion. Mm-hmm. If some people just said we don't know.
There's a lot we don't know.
I think that's fine to say that.
Yeah.
I was going to ask, is there any better way than these cards that we have going out? Are they creating a better system than the COVID vaccination cards? Something maybe that, because, there's so many people faking the cards, so we honestly don't know.
Yeah. We're still seeing, remnants of individuals using fake vaccination cards, which is unfortunate because you have to think about other individuals, just not yourself. But here in New York, we have a couple of different passports that we've been using. And many of the businesses are using sort of the New York State Excelsior Pass, and in New York City, we have the vaccine app. But nationally, we haven't heard anything just yet. But I'm sure there's things that are being worked on.
All right. And when we talk about getting vaccinated, the numbers for Black people getting vaccinated are still way lower than everybody else. So has that been improving at all? And what are some things that can be done?
Yeah, I mean, I want to start here and just say that we made tremendous strides here in New York City, particularly because we know sort of longstanding issues around medical discrimination and bias that we've seen in our healthcare spaces. Across this city, we've been able to get many Black and brown communities vaccine coverage up to 70%. Right? If you ask me in 2020, do you think we're going to see high vaccine coverage in Brownsville, or you're going to see it in East Harlem? I would have told you no. It's just going to be a challenge because I know that there's a lot of distrust around these vaccines. Right now, where we're at in New York City, fully vaccinated, we are about 87% of all ages that are eligible. For adults 18 and older, we're about 90%. I mean, that's tremendous. And then when you break it down by race and ethnicity, we're at 60% for Black individuals 18 and older who are fully vaccinated. So that's not something that we can just laugh at, right? Like, we did some tremendous work, and really it's been based on a lot of the community partners, faith-based organizations that opened their doors and said, come on in, get vaccinated, right? And what we're also seeing is that white New Yorkers, particularly young white New Yorkers, are saying no, right? Like, we're seeing that there's still some hesitancy there. So there are pockets where we have to continue to dig deeper and get the message out and talk to them about why this is important. And that's what we're continuing to do. And so, but, kudos to all the folks who have been like just really out there knocking on doors, helping get the word out why this is a safe and effective measure of staying safe.
Were you hesitant at all when you first got vaccinated?
No. I got my vaccine really early. I was March of 2021 because I knew that it was important for me to be out there as a leading public health official for this city.
You got Johnson & Johnson, didn't you?
No, sir. I got the Moderna vaccine.
All right, Dr. Torian Easterling.
Thank you for joining us, man. We appreciate that.
I appreciate y'all. Y'all having me back. We talked about the flu vaccine last time, so just getting the word out. So appreciate y'all for opening up.
It's Dr. Torian Easterling. It's The Breakfast Club. Good morning.